Wow. It is.
This meeting is being recorded.
Hey, good people. This is Arthur, your host with Pain Relief University, and we have along with us, as always, our favorite physical therapist, Catherine Sylvester. Though right now we're not on one accord because she surprised me today.
You gonna say that right now?
I am.
On camera?
We're gonna put this on the recording, right? So I have the esteemed surprise and pleasure of introducing, Pain Relief University community to my mom, Rosie Toole. Actually feels odd saying Rosie Toole. So, hey, Mom.
Hello, son.
As most of you guys probably don't know, you guys know the net and our story in terms of how we came along with Nutmeg and came to MegRelief. But what you don't know is that one of the first people who were using MegRelief was my mom. So I'm sure we'll get to that a little bit later. So with that, to be unbiased, I'm not going to ask the questions today. We're going to let Catherine ask the questions, and we'll go from there. So let's get started.
Which don't act like you ain't very happy to do that, because every week you try to get me to ask the questions. So here we are.
Stay focused and professional.
So I affectionately refer to Ms. Rosie Toole as Mama Rosie. So you'll hear that throughout the interview or conversation. But I'm so happy to have you on here. Such a beautiful woman that I admire, not only as a therapist, but as a mom and a friend. So thank you for agreeing to come on. And, you are Arthur's inspiration. Every time he makes a change to MegRelief or adds a product, it's because he's thinking of you. And, you were the genesis of it. And you are such a huge supporter.
You just gonna put it all.
So we had to have you on.
I'm so happy.
And as you listen to all, I'm so happy you're here too. Okay, so can you bring us up to this point in terms of your experience with joint pain? So tell us a little bit about your background and what you're doing now, but also your journey with joint pain, if you can do that for us.
Yes. Well, I come from a family with a history of osteoarthritis, and it hits multiple joints. And my first experience was in my knees, and from my knees to my hip, to my back, to my shoulders, to my hands. And I began using the MegRelief on my shoulder and my hands, because by the time MegRelief got here, I'd already gone through some procedures with my knees and hips. But I still will use it because sometimes when humidity has changed, I still get an ache or two. So on any joint, I am prone to spray the MegRelief. I am partial to the spray, but I think it's because that was what I was introduced to first. But I've used the spray, I've used the rub, and here recently I've used the soap.
Okay, so you told us that you had some joints replaced. What were you doing up until that point? So you had pain and you were working, correct?
I was working.
Okay, and so what were you?
As a therapist at that time. And I was medicating with the ibuprofen, which is not a good choice because at a certain level, you risk stomach damage using ibuprofen and other issues, digestive issues. But I didn't know of MegRelief. I had tried several other brands. Being a therapist, you're in quite a few clinicals and you use certain topics and nothing was doing it except, okay, I've got to medicate. And I really didn't want to internalize anything because I did know the side effects, bleeding, ulcers, just a multitude of things. And then my son came up with MegRelief and hey, let's try and see, especially with the ingredients. I mean, you can't go wrong.
Yeah. Now, when you were taking medication, at some point, did you have to end up take more or get injections? Or, what did you do up until your replacement?
I tried injections. I had multiple injections. And it's funny, fast, I was speaking with someone earlier this afternoon, and those injections were $200 a piece. And
Oh,
they may
wow.
work and they may not. And what made me finally stop getting them in my knees is because the relief was so temporary. It may last 2 days, it may last 2 hours. It just depends. And you can't keep doing that. You just can't. And then really after a while, the physician will say, no more. You can't have any more injections, because that type of stuff will move internally. It's not like it just dissolves and goes away. It can move and cause other damages.
Yeah.
So
wow.
you are taking internal medicines. I've tried that. Injections, I've tried that. Replacements, I've tried that. But this spray, I like the best.
That's awesome. And so you spray it on, and then do you rub it in? Do you just spray it and leave it? How do you use it, and how often do you use it?
When I use it on my shoulders, I generally will have something sleeveless on, and I just spray it. I don't massage it in. But on my hands, because both hands have osteoarthritis at this particular time, a lot of the joints stay inflamed. I spray it in the palm of my hand, and I really use it as a lotion and massage through, and then just let them rest. And then I get the benefit of it. So it depends on what area I'm using it in.
Yes, because you're the expert user. So we need to know all the ways that we can use it. Okay. That's awesome. And you said you recently tried the soak.
Yes.
The foot soak. And what did you do with it?
I used the soak on my hands. I've spoken with Arthur earlier, and I don't have any issues, hallelujah, with my feet. But I was just wondering, would it work on my hands if I set it up, just like you would for your feet, but insert hands? And he thought it would work, and I tried it, and it was really, really good. And I've tried it twice since then, so a total of 3 times. And it's a strange feeling. Like I told him, I could not text him the words to explain, but it was relief. Versus when I use it on my shoulders, there's a chill, and then there's a warmth, a soothing warmth that happens. But with my hands, I got the warmth because the water was warm. But after the 20 minutes, and I took my hands out and dried them, there was this cooling sensation. And it really felt good. And my joints didn't hurt anymore. So I like that. It was different. I like it.
So
that is awesome.
Say something here. My mother is very quick to say what she doesn't like, and she can post anything. So I will enjoy this moment right here where she says something that I've had my hand in, met with positive results. I'll just leave that right there. I'm gonna go back quiet.
Wow, so that's the only
but you don't
thing
want
you
to
wanted
waste
to say.
time. It either works or it doesn't. And if it does, hey, that's a good thing. Keep it up.
No, I'm with you. I am with you. I'm just enjoying this moment, right? So okay, yeah. I'm gonna be quiet.
That's
so one of the things that we would like therapists to start thinking about. So we got to talk from your use of it from that perspective. But let's say that you could flash back to your occupational therapy days. How would you like to see something like this incorporated into the clinic? Because you remember the days when people would take medicine before therapy so they could tolerate it and things like that. And it makes us cringe as therapists, right? But what else do we do? Because we know that they need to be able to tolerate therapy. So how do you see this being incorporated in a clinic, if you do?
During those years, I have reminded patients that you take your medication, your pain meds before you came in, because it's necessary. But during that initial period, when you're doing vital signs and checking just verbally how they're doing, while you're doing that, I think you could apply either the spray or the rub or whatever and let it begin to work. And say if you were working on range of motion, by the time you get the vitals down and record it, they ought to be feeling that sensation of decreased pain and warmth and comfort. So I can see where you could get increased range of motion. You would get them to relax because they feel like you're not going to do something to hurt them. And it could progress in that way. It really could. And then if you've got somebody who's fixated on their pain, start there. You know, get that sensation, whether it's the warmth or the cooling sensation going, and they'll do more because it hurts less. So it's a good starting tool.
Yeah, I think that's a great idea too. Because once they get moving, then they may not need some of that other stuff, you know. How often do you take pain medicine now orally?
I do not.
Oral pain medicine.
I do not.
Okay. Okay. And then how much were you taking it before? This is really good to know, right? So
well, with the ibuprofen, it's not what you should do, but we're talking about what I would take 400 milligrams of ibuprofen in a setting, 4 to 6 hours. And that is too heavy a dose for the average person. But you have to understand, I was on my feet and going through different rooms and levels at the hospital. You got to be able to function. You can't be the therapist coming in saying, oh, my back hurt, oh, my knees hurt. You got to bring your equipment with you and do what you came to do. You know, get them up to walk, sit them on the side a bit, whatever. You've got to, function. And so if anybody at the hospital needed ibuprofen, they always came to me because I had ibuprofen.
Wow. Yeah. And now you don't have to.
Actually, I have a question. So your background is as an occupational therapist, and then you had a history of osteoarthritis. Let me make sure I said it correctly. And so, but you know the science, you know your history. What made you say, you know what, I'm gonna try this, right? Like, you know medicine, and you've seen patients, in the best and worst, but you were willing to try something new, right? So, I mean, what was that thought process? Or was it simply you were in enough pain, or was it, hey, because the reason why I'm asking is because I think at that point, and at least from my view as a child at that time, you had your pain management system in place, and it kind of gave you a measure of control of your pain. At least that was my perception. And obviously I didn't know you were in as much pain as you were in. But if that is true, then what made you say, I'm gonna try this?
Well, my first love was not physical dysfunction. My first love was drug abuse, and that in the psychological level. We used to just call it psych. And that's what I did my rotations in, and that was my heart. But by doing that, I saw people my age and older and much younger that had become addicted to pain medicine.
Yeah.
You would ask, when did you take your first pain medicine? Well, I had a car wreck. I rolled my car and my back has never been the same. And I was using drug ABC, and that didn't get to be enough. And then the doctor quit giving a prescription. So then I got it on the street. And the next thing I was taking a combination of that. That was the general story.
Got it.
So I knew for my pain, I'm not going down that road. It's got to be something over the counter, and it's got to be at a level that'll at least make the pain tolerable, because I know the pain is not going to go away. It's got to be tolerable. And that's when I looked at things like Tylenol and ibuprofen, and there was another one. I can't remember the name now. Aleve. And everybody spoke how highly it was, but nothing worked but ibuprofen. But the thing with ibuprofen, I started with the normal dose, 1 every 4 hours, then 1 to 2 every 4 hours. And like I said, by the time I had the surgeries, I was up to 4 every 4 hours. And then after I retired, it was like, okay, let's just back down, because now you're at home and you can do some other things, because I do know the risk of some damaging internally, even with over-the-counter stuff. Mm-hmm.
That makes a lot of sense.
Right.
And it also explains, I want to give some context to the Pain Relief University. I've talked about my story in terms of, knees, and then how I had surgery in the military on my wrists, scaphoid lunate instability, or whatever the term is. I don't know. I'm not the doctor. But I do remember them giving me some prescription drugs and you taking them. And it was always the running joke afterwards. I was like, the doctor gave this to me. I'm in the military, so I'm old enough to kill, but I'm not old enough to take my own medicine. And yeah, so you took that from me. But I understand that now. You've seen the worst of what.
And I took it from your sister also, remember?
Oh yeah, that is right. Yeah, so that's right. So yes, so. But no, so that's
what good moms do.
Right. No, yeah. And so I'm in the hospital and it's my mom. So it's, what are you gonna say? Right. Okay, I guess I did. And it was the right decision because I didn't need it. The doctors gave me this stuff, and because I'm not, I'm a layperson in terms of medical community, I just assume whatever the doctor gives me is what I'm supposed to take, and I would have kept taking it. Never mind the fact that my family has a history with drug abuse and stuff like that. So, you would marry and being a mother with your medical history and were able to make a decision on my behalf that's resulted in a lot of benefits for me and for my sister. So I'm grateful to that. But now I understand more context of why you did that. I honestly just thought you were just, being a mom, it's like, hey, he don't need that. I didn't realize the other aspects that you were taking into consideration. So I'm grateful. So that's it. I'm not interrupting anymore.
What doctors tend to not understand is everyone does not need the same strength because you're Black, because you male or female, or you're obese, or you underweight. They just got this blanket thing where you fit this group, someone will give you this dosage, and it's not needed. Every time I go into the hospital for surgery, I tell the anesthesiologist, I know you're going to look at my weight, my height, and my age. I don't do well with anesthesia. Don't give me the normal dosage you would give a person my age. They go, okay, yes, ma'am. And then when I do wake up a day or two later, I always hear, at least 8 out of 10 times, we couldn't wake you up. Duh, I told you. So that's where everybody falls in. They go, oh, well, you're 22 years old, you're running and you're doing this and that, and we're going to give you this dosage. It shouldn't do that. Let's try something like MegRelief, and then let's go from there instead of starting with a prescription medication.
Yeah, no, I know that saved my life. I don't even know what it would have been like because in the military at that time, there was a history, a pattern of just, soldiers of mine, having surgery, getting injured, and then taking medication. And it was something that we had to do briefings on to provide education to help prevent drug abuse or drug dependency. But in that moment when it was my turn from an injury that I sustained while on active duty, fortunately, I had an advocate in my corner that was like, hey, he may not need this. And so that was great. Everybody doesn't have that, which is why I like having Catherine on what she's doing with her Operation Miss program, how she's an advocate for her moms. So Pain Relief University is not against medicine or traditional medical practices. It's like people are unique. And if we just look at people as individuals, this may work for you, this may work for you, this may work for you. And it's giving people that voice, which is why we're bringing on, advocates and healthcare practitioners like yourself and others to be able to talk that language to us lay people to know that, hey, if your gut is saying maybe you should pause on this, or maybe you should get more information on this, that they feel they have the freedom to do so. So just having people like you guys in your spaces gives me more confidence in the medical community because, just when you see what's on the news, see what's on TV, you hear people suing the hospitals, somebody left a cadaver they just did something, right? It's good to know there's people who care about the individual person and is willing to make the hard decision for the best interest of the person. So that's great.
Yes.
All right.
It would be great to have doctors also, inform that before you write the prescription, let's try something else. And there are doctors out there that are open to it because they see just what the therapist sees and the nurse sees, and they'll tell you 123 bed A is pain seeking. They're gonna don't give them any more than what I've written in the chart. And as soon as that nurse goes off the floor and another one comes on, oh, I'm hurting. Well, she didn't give me the pain. Well, she noticed she did, but I'm hurting. And then you may catch a doctor there, a hospital says, well, just give them another one. I'll okay it. And then they write something in. And you can be in the hospital and become addicted. And that's a place where you're supposed to be getting help, not, harming yourself. But we just need
Mama Rosie,
word out that there's something else you can do outside of ingesting some medication.
Yeah.
That's what I was thinking, because you know how you'll have a patient and they need medication every 6 hours. So there's on rotation. They'll wake patients up to give them medication. So then the patient asks for it at 2 hours and they're like, okay, let's just order some breakthrough medication. Well, why can't there just be something you rub on in between the 6 hours, in between treatments and administration of medication? And so I think that would be such a good thing. Try something else for breakthrough, not something else oral, where they go from, okay, I'll inject it every 4 hours, but you can take it by mouth or take something different by mouth in between. And so I think that there's just a lack of awareness, I just don't hear doctors saying, hey, you have a headache, try something topical. No, it's, hey, you have a headache, try Tylenol, ibuprofen. It's never a topical thing to try. And so I wonder, what is the reason for that? I just don't know what that is.
Because most people are seeking that. And so let me give you that and get you out the office. And I'm back to a 15-minute treatment so I can see everybody in the lobby and I may get home, at 5 this evening. It's sad. It's sad. But, here in Alabama, we have plain clinics at the wazoo. And that's just what happens. It's just a meal you go through and you tell them what you want, And so they write your prescription. You pay your cash money and you go on about your business. And so it's bad. It's really, really bad.
Yeah. Now let's talk about this. So what about people who, let's say even with MegRelief, so they have the MegRelief, but they know they have arthritis. What would you say to the person who just puts it on, but doesn't do anything else? What would you say to that person in terms of, I guess, the importance of pairing the topical with movement or with something else so that they're addressing the underlying issue?
First of all, I would tell them that you don't let the pain get too severe. You can look at your joints and tell when they're getting inflamed. Not only will you be feeling it, but you can see it. So at that point, go ahead and get your ointment. Depending on the joint, we'll say it's the hand, then you need a ball. You need a hand stretcher, hand exerciser, because movement is the key. If you don't move it and then decide you want to move it, it may not move, not even with the MegRelief. So go ahead, apply your MegRelief, begin to get whatever sensation you get from it, the warmth, the heat, whatever sensation, and then begin your exercise. And I think that's a wonderful way to do your group. You get a lot of benefits from that.
Yeah. Okay. Do you have any other questions for your sweet mommy?
Really? My sweet mommy. This is what we're gonna do? A grown man. Okay, you're talking about my sweet.
Well, you repeated it.
Because you put the energy out there, okay? Listen, no. It's funny. So when MegRelief worked on me, it was like, okay, cool, it's me. When it worked on my wife, Danette, it's like, oh. When I saw it work on my mom, that was different. Not only because of what I said earlier, because if it doesn't work, she's just gonna tell you like there's nothing nice about it. She's like, get this crap out of here.
It seems so cruel.
No.
I'm not cruel.
No, you're not. You're very loving. It's just you're honest. you're just honest. Like, nope, this doesn't work. Don't bring this back to my house. But when I saw it work on my mom, it was at that point that I was like, I want to share this with everybody, right? It was a dual thing, not just because you can make a business out of it, but I was able to help my mom in a way that I couldn't before. And my mom is very strong, and she doesn't really ask for help or lean on anybody, at least not from what I could tell, which is quite frustrating as the son. But to be able to have something that could help her, I wanted to make sure that everybody had something that they could help their mom with. So the push for it to make MegRelief a business was in large part because of, I knew it helped my mom, right? So if it helped my mom, then I know it's gonna help. And then after that, everybody already knows this, that's listening to this, connecting with Catherine, and then I have another healthcare practitioner saying, hey, there's something to this. This is actually working. I said, okay, yeah, now we have something. It's not just that it happened to work for me, or it happened to work for a couple of people. Now it's worked for people that I love and care about, and medical practitioners. And so we knew that. So that's what I got from that. So that's it.
Well, the neat thing too, just when you said that, is that it didn't just work for a couple people. It worked for hundreds of people.
Well,
like
yes,
and that's what I love about, right? Is that sometimes people have something and it works for a few people. Mm-hmm. So then they're like, oh, okay, I'm just going to put it out there. But you waited till it worked for about 400 people. Then you're like, oh, okay.
452.
I might have something.
I waited till the 452nd person was 452. Then it was like,
that's so sad. Yeah. Think of all the people that missed what you had to offer.
I was trying to be careful. I wanted to be responsible. I was like, I need to know. Like, I had all the signs and all the people saying, yes, this is something new. We passed the 100 mark. I was like, I don't care. Let's just see. Then 200. Let's just see. 452.
That's so sad.
And I was like,
that's
okay. Sad. Yeah. So, and then we had people start buying it again and repurchasing it. I was like, oh. Okay, with no marketing, you're buying this again. This actually works, not just for me and my people. I understand, but I just, honestly, I just wanted to make sure that it was something out there that was done and decently and in order, and it complied with all the applicable laws, but it still adhered to nature being a better pain reliever than something that could be made up in the lab, right? And so, fortunately, I was able to partner with people like you guys, and just make it what it is, right? That's it. So I guess I'm not all the way upset that you brought my mother onto this podcast.
I'm glad. Yeah. Thank you.
Well, your mother will tell you it's an excellent product. Okay. Now your ultimate challenge is, because I like to do the games on the computer, and they have these pop-up commercials. I want to be playing a game eventually and MegRelief pop up.
Amen. I was gonna ask you, what if you wanted to say something? What would you say? That would be wonderful, right?
That is what I
mean. Yeah. And for me, I always think about it being the thing that therapists recommend, because right now everyone says, try BioFreeze, try whatever. And those things, while they work for some people, they have chemicals in them. And some people, they just use it. I had someone most recently, they were like, well, it just feels like water. I just put it on because my therapist told me to. And so it's like, why not let this be what the therapist tells them to put on? It's super effective. You can use it everywhere. And it's not just good for joint pain, we found out, for trigger points, for sciatic pain, for people who have, it's just been so effective that it can be that thing that's the household name. So that's what I would like.
And trying things like BioFreeze and Icy Hot, I've tried that. And with one of them, it was okay, but it was too liquidy. And it would get away from me before I could manage it. But with the MegRelief, I know to spray once or twice. It depends on where I'm putting it. I got plenty, okay? Whereas some of the other, you just got a lot, and then you got to be careful how you apply. But it is the better of the topicals that I have tried.
Awesome.
I love that. Well, I want to thank you for coming on. It is always good to see your beautiful face.
Oh, my pleasure.
So thank
My
you.
pleasure.
I guess thank you.
I'm so glad y'all are working together. That's excellent.
You know, I have to carry her, you know what I'm saying? So
oh wow.
It's my burden. You know,
Not
but
Carrie.
I wear that burden with honor because
REPENT.
Okay. Yes.
you know.
Now that'll send you straight to hell, okay?
See, that's why we need Mama Rosie on. That's why we need some real talk on the podcast.
No. You know, we all love Catherine. Catherine's family. So
yes.
So
yes, she is.
That's it, Ma. I just, again, thank you for coming on. Regardless of me not knowing you were coming on, I am grateful that you are on, and you for sharing your insight. And actually, you gave me a couple of ideas on how we can share the word and spread it out to more people, so more people can find out about it. So thank you for that. Who knows? Maybe we'll have you back in future. When I can plan it, right? So we'll see how that. Kathy, you got anything else? Catherine, got anything?
No, sir, I do not.
All right. Well, this concludes another one. You guys, we'll see you next time.